Chest seals, and why are they so important? Today's tip is going to be about preventable death injuries due to chest trauma and why it's so high in civilian versus in the military environment. If you think about it, civilians don't wear body armor, military folks do. That's why there's a higher instances of preventable death injuries due to chest trauma in the civilian population. Why is that important to you and to us as first responders? Because chest seals. Chest seals are an important part of a trauma kit, and we have them in all of ours. Now we're going to learn how to use them and where to put them on, but I want to give you a brief overview of how we breathe normally. So if you look at this torso here, and torso to us means the box. It's from your belly button to your neck, chest, sides, and the back side. That's our torso. So how do we normally breathe? Well, it all works on the principle of negative pressure. We have a closed compartment in our chest cavity, and as we inhale, what causes the negative pressure in our thoracic cavity is the diaphragm moves down, the intercostal muscles expand, and that creates a vacuum or a negative pressure in the thoracic cavity, which allows air to come in through your mouth. It's a normal process. When you're sleeping, you're not thinking about it because of that negative pressure. Now, what happens when you get a bullet hole, a stab wound, shrapnel, some kind of insult to the outer part of your chest? Well, that affects that negative pressure. Now air comes through this hole, and when you breathe out, it doesn't necessarily come out your mouth. It gets stuck in this cavity. So we have to find a way to relieve that. Can it be caused by other things other than the external? Yes, and we'll talk about that in the future, but that's in relation to spontaneous pneumothorax, or the injury, the lung itself is getting injured inside through a blast injury or something like that. So how do we treat it? Well, if we want to close this hole up, we can do one thing is we can put our hand over it, but it's not a perfect seal, right? They used to put some saran wrap over it maybe if you had to improvise, but not a perfect seal, and it's not tight. They used to teach to put a three-sided dressing, meaning you cover a dressing in three sides and allow one side to come up. So what we recommend is a chest seal. These chest seals, this one here specifically is from North American Rescue. It's the hyphen chest seal, a very popular one. And as you look, there's basically three channels, and that is creating a valve. So three, in essence, valves, where allow as you breathe in for this to suck into the wound, and as you breathe out, air will now come out of these three channels. It comes with this gauze here, so if we did have an injury right here, you could clean it off anywhere again in the box. So belly button to your neck, front, sides, or back. We don't put this on your leg or on arm. That's what we do the other things. So we've cleaned it off. You then have this little red tab here. We peel this off, and one technique is to just put it directly if you don't have a lot of stuff on your hand. Sometimes a long shirt or something like that will get stuck. This is extremely sticky, and we go directly to the wound. Another technique I want to show you, and this would be one of the preferred methods, is as follows. Let me put this back on. So that would be lifting halfway up and placing that on the middle, and then as I put the rest on, I remove that extra piece. We want to get that lined up in the middle as best we can, and we want to monitor the patient for increased difficulty breathing. If they do have increased, we call this burping the wound. You would remove this off and allow some of that air to come out, just like this. You literally can press on this cavity here, try to get some of that air out, and then we can cover back up. This is a great option, this hyphen chest seal. And where do we put it? We put it on the box. That is from your belly button to your neck, front, sides, or on the back. This is chest seals. This is how we use them. We'll do other videos that talk about the different ones. Thanks for watching, and let's save lives together.